You are listening to the Manhattan Tri Club Leading from the Front podcast. We are based in Manhattan, Illinois, a southwest suburb of Chicago. Please follow us on Facebook, Instagram, and YouTube at the handle Manhattan Tri Club. We hope you like the show. Hello, welcome back to the Leading from the Front podcast with the Manhattan Tri Club. We have a really cool show in store for you today. We're back on our normal cadence. We're down one. Bridget's not here yet. We're hoping she'll join us here later, but we have a very special guest. We have my dermatologist from Fine Skin Dermatology, Dr. Maria Wemple. Hi, Maria.
Hi.
Welcome. We're going to hear about how awesome Maria is and how everybody in our triathlon world should go see Dr. Maria. Nobody else, just Dr. Maria.
No one else.
But we got April. Hey, April.
Hey, everybody.
So just a forewarning, you guys have all heard all of the puppy sagas lately. Grace is on puppy duty right now, so we might see a guest appearance in the background. My little jerk might sneak his head in too. So all bets are off as it relates to puppies. So we had a really fun weekend last weekend. We had the Illinois State Masters swim meet, and it was my first swimming competition ever. Never thought I would say I did a swimming competition, but it felt a lot like a wrestling competition, the way you swim and then you sit around and you swim and then you sit around and watch all these other people. And it was cool. There was lots of cool races, lots of fast swimmers, lots of scenery, good and bad. And we had some really cool performances, and April is one of them. She did absolutely amazing, and I'll brag on her a little bit. April swam a couple events only on Saturday. She had a commitment on Sunday, so she didn't show up on Sunday, but she did the 50 freestyle, and it was her birthday. Happy birthday.
Thank you.
She did her 50 freestyle in how long?
31 seconds.
30 freaking 1 seconds.
I was actually more proud because that was my first race. So I feel like you're always a little like timid, and it was a relay too. So you're always a little timid to get off the blocks, whatever. So I was more proud of my 100 time because I cut, granted, I've only done 2 swim meets, but I cut another, 5 seconds off my 100 time. I also took a bad turn on my last 50. So I felt really good about that.
Awesome.
Yeah.
Yep. And Grace, we missed you. We know you had a commitment with Alexis, and hopefully she won her soccer game. But yeah, Alexis is a good reason not to show up to a swim meet.
Yeah,
we'll give you that one. But yeah, I think I was in 6 different events, 3 individual and 3 relays, and I had the most fun in the relays because there's no pressure. And our swim coach Chuck put me with all the super fast swimmers, which was awesome. April and I were in one relay together, and we did pretty good. She kicked my butt. I had a good time in my 100. I went 1:19 for the 100, and I did a couple of 34s and 33 relay 50s. So,
yeah, and you had that 100 time, even though you stopped at each wall and like looked around, took a coffee break.
I did.
At one point, Bridget and I were on the side of the lane because he was on the wall, on the lane in the wall. We were screaming at him because we knew he could see us, like, keep going.
Maria, are you a swimmer? Have you swam?
Like casually, not competitively.
Yeah, it is awful. It is the hardest sport I've ever done. And
some friends swimming and said the same thing.
Yeah.
Yeah.
Grace and we're always locked in. April is the epitome of an overachiever. When the coach tells April at the beginning of practice, all right, swim 400 easy, April's full gas from the minute she starts. And I used to be able to keep up with her, but now she found her stroke, and she can, now there's no shot. She's moving down to like the swimmer lanes. We're in the middle, kind of lanes 1, 2, 3 in swim practice, and that's for triathletes, new swimmers, people that are not good, and they just kicked April swimmers down. We are good swimmers. Chuck's gonna yell at me because he's gonna hear that. And Chuck's our other swim coach. So, but it was a lot of fun.
But I like to swim with my friends. That's the problem. I just want to swim with my triathlete friends. And now Val's going to go make swimmer friends and go to a different lane. I should have really like sucked. I don't know how to not compete though, is the thing too, is I love competition, and I like specifically races are like I just love them so much.
Yeah.
So I couldn't cheat or couldn't sandbag.
Couldn't cheat.
Yeah.
You know?
Well, and I'm extremely competitive too, and it's hard not to be good. I'm getting better, and I'm actually doing better than I'd say I'm slightly above average now with my swimming.
I would agree.
And
sure.
I'm gonna dig into this 100 here because there was no coffee breaks. I was literally dying at the end of the first 50, and that I came out of that 100, and I'll bet you my heart rate was close to 200 beats per minute. I literally thought I was gonna die.
Your brain does not need oxygen until what? Like 10, like you can go how long, Maria? You're a doctor. 10 minutes without oxygen?
Yeah, no way.
Right? Like you can go a minute 19 without breathing. Just keep it going, Chad.
Yeah.
For the listeners, you really
Yeah.
don't think can go 10 minutes without
That.
Don't try this at home.
Thanks, Lawyer Grace.
With like breath holding or something, it's like 7 or 8 minutes or so. It's up there. It's
See?
up there.
That was close.
But you got to train. You can't just.
Yeah, Chad's not doing that at practice.
No.
Yeah, no, he is absolutely not. Yeah, so that was fun. And then on Saturday again, I had I don't know why I signed up for the 200-yard individual race, because I figured 200 yards, we swim that for warm up and a practice. That's no problem. So Scott Freck was coaching me before the race. He's like, all right, so you start out nice and slow. Him and Nancy both start out nice and slow, get in a groove, swim your first 100, and then start to build your second 100. Well, what do? I jump in and I hammer it for the first 100 like I did the last time. I get to the wall after the 100, and I started getting a cramp in my side, and I came up to the wall, and I'm like, I'm done. I'm not going to swim the next 100 yards. And I put my arms up on the wall, and I start to get out, and the timer girl she's like, no, you have 4 more laps. I'm like, no, I don't. And then I see Nancy come running around the other side. And right when I sit my butt up on top of the deck, which once you do that, you're done. Once you're out of the water, she's like, I was going to tell you, just hang on and swim. You can swim that last 100. I'm like, I'm okay. I don't need to swim that next 100. So, of course, we got a group text going, and April's wanting to know how everybody's doing. And I texted that, I didn't finish that race, and because I had a cramp, and I was looking for some sympathy. And April's response in the text was, you had a cramp, or you realized the distance was longer than you wanted to go.
Yeah. No sympathy from me.
There was no sympathy. But Grace, I go to Grace for sympathy. She gives me sympathy.
Yes. You got to talk to the right person for what you need.
Yes.
Yeah. But yeah, there was some really cool, probably the coolest swim that I saw. The entire place just erupted. There was a couple of national records that were set, and there was this young guy that was just like, I've never seen anybody swim so fast. He literally did the backstroke. He did the 400 IM, and he set a record. And on his backstroke leg, he went under the water. He came up, and he only did 6 strokes because all of it was underwater. It was amazing. And he was like 6'4", real tall guy. He broke a couple of records, younger guy. But the coolest was a national record was set by a 95-year-old man. He beat the 400 IM record by over 2 minutes.
Holy cow!
And national record for his age group.
That's incredible.
This guy gets out, and they announced it right away, and they helped him out of the water, and he's walking, and they announced it, and literally it was like you were at a World Series game. The entire place just went bananas.
That's awesome.
It was really cool.
So cool.
So that was our weekend. Bridget did awesome. Bridget hasn't been able to train much, Maria, because she had ankle surgery 4 months ago.
Okay.
So she's just recently got back in the pool, and we dragged her to this swim meet, and she's the swimmer of the group. So that's her background. So nice. We weren't going to let her off the hook, but she did awesome. She was there with me both days.
She's the one that made us sign up for this one.
Yeah.
Should we talk about your comment about the scenery because I think it could lead to a dermatologist question.
Yes. Just remember, I've got the edit button.
Yeah. What his comment was.
All right. Well, we'll see how this conversation goes because we're not cool hip people. I'm unsure if she is a cool hip person, but Maria, like we,
Yes.
as swimmers and as triathletes and like just the nature of the activities we do, we shave a lot. And so like
Sure.
Grace and I have talked about like, you know, razor burn and like making sure you're using the right products and, you know, making sure you're comfortable because sometimes you do get razor burn. This girl was not adhering to the swim meet unspoken rule of shaving everything.
Okay.
And her swimsuit was not covering all of her hair in her lady bits.
Yeah.
Well,
Hey, you know what?
And the worst part is that she, like, I was sitting in a chair. We were all sitting in a couple chairs next to each other, but Bridget and Chad were a little bit further behind me. And for some reason, everybody kept cutting straight in front of me. So I was like watching the meet, not paying attention. This girl like cuts in front of me, and I was like, "Whoa, that was way too close for comfort, and no way that I couldn't miss it."
so April's not really doing the whole
She needed the
lady
break.
bit part. She's not doing it a whole lot of justice. It wasn't just that part. It was like a continuation, and it went like almost down to knees. I mean,
So maybe we're dealing with some like we don't shave because we've had some razor burn issues. But what would you
Maybe.
suggest is the best product to handle scaping and or razor burn?
I honestly, I have one and I don't know the name of it off the top of my head. So if you let me look it up, because I don't often, I mean, I honestly, like, surprisingly, I don't get a ton of patients that have like horrible razor burn. If it's not something called folliculitis, which is like different, it's an infection or inflammation of your hair follicles. But I did actually see someone recently, here we go. It's called Tend, like TEND skin solution, and it really helps with like shaving bumps in essence. So it's not like a cream, but it's something you would put on after to kind of help soothe.
Oh, nice.
So Tend skin, like I never remember it, but I have it on my phone, so
I have
I look it
used
up.
Neosporin as soon as I get out of the shower,
Okay.
and that seems to help.
Yeah.
Have you
Yeah.
heard of
I mean,
that?
anything that just moisturizes for sure. But this one's pretty good, that one. And it's cheap. It's not expensive, but I haven't actively looked for it in a store. So it's probably one of those online buys.
Okay.
But
Tend.
yeah,
Okay.
just for the record, I'm not included in the razor burn
the razor burn, sure.
conversations that they're having.
No, that was a girls'
Yeah.
bathroom conversation.
There is very little shame among triathletes and
Yeah.
generally endurance athletes.
Yes.
I'm sure we'll end up talking about poop along the way someday.
And our
Yeah.
outfits
During this.
leave very little to the imagination.
Yeah.
And
Yeah.
sometimes after the very long swim meet or after very long bike rides, you're tired of seeing everybody in their spandex and their swimsuits.
Yeah.
Yeah.
Yeah,
Yeah.
we're just surviving. We're all just making sure we're
Yes.
comfortable and surviving. And
There
that
you go.
Tend skin solution is actually, I did a
Yeah.
quick Google search. You can get
Yeah.
on Target,
Yeah.
Walmart,
Nice.
Walgreens.
Yeah. So it might be on the shelves. I guess I've never like actively looked for it, but yeah.
Well, aren't you lucky? We just have
Well,
a lot of
I've-
movement in the leg area.
That, or you know what, you can go in for laser hair removal at a derm office and not have to worry about razor burns. There you go, too.
Interesting.
Even
That's a
better. We're all calling the office tomorrow.
Yeah, right.
Right.
Oh.
Does your office do laser hair removal?
Yeah, we do cosmetic and
Okay.
medical.
Interesting. Well,
Yeah.
that's a good segue. So let's jump right in, and we talked a little bit about some of the trials and tribulations of razor burn and
Swimming.
non-girlscaping. But so I met Dr. Maria in 2017-ish. I've been a patient for about 9 years, I think we figured out. And a funny story. I really never went to the dermatologist, and cancer runs in my family. And I just decided in like 2016 or 15, I started going to the dermatologist, and I started going in Orland. I found this Fine Skin Dermatology, Dr. Bott, and made an appointment, went and got skin checks, and I started doing it pretty regularly. And I was on like the 1 year regimen. Every once in a while, they'd freeze something here and there. And I was going to a doctor named Kelly, and I made an appointment for the next year or next 6 months, whatever it was. And I show up to the appointment, and the person at the front desk says, "Okay, well, you're going to be seeing Dr. Maria." I'm like, "Whoa, whoa, whoa. Where's Kelly? I go to Dr. Kelly. Who's this Maria person?" And she's like, "Don't worry, Kelly's no longer with us. You'll like Maria. She's awesome."
Just not with the
I'm
practice. She's alive.
Not with the practice.
She's
I know.
alive.
Yeah.
She's still around.
Kelly's fine.
Yeah.
So I go in there with that skeptical eye, and I meet Dr. Maria, and I'm like, all right, she's okay. She's good. She put up with my shenanigans. Because I'm not just a goofball with you guys.
This is
Christian
Chad
Maria's
every
seen a lot
day
of it,
with
too.
everybody.
Yeah.
Yeah.
Hey, I appreciate the realness. Yeah.
Yeah. So I'm going to tell a really funny story. Maria doesn't know I'm going to tell this story, but this is not a HIPAA violation.
Okay.
It might be, but it's mine.
You're doing it.
So Maria's she sees my wife, she sees my son, and my son's he was a wrestler, so he had some skin stuff with wrestling, it can be kind of gross, but she was seeing Sean, and I was just starting to ride bikes. This was a few years ago. I was starting to ride bikes, and I was getting saddle sores really bad, or folliculitis. It was in that area.
Mm-hmm.
I had this one that was pretty painful. So I was on my way home from work. Linda and Sean were in Maria's office, and I called. I didn't know that they were in the appointment yet. Linda answers the phone, and she's like, "Hey, we're waiting for Dr. Maria to come in." And I'm like, "Oh, well, could you tell her I'm seeing her in a couple of days? Tell her she's going to have to look at my ass, and I'm really sorry about that." Linda had it on speaker, and Maria was standing right there. So they thought it was funny, and so so I do this all the time. I'm no different.
Yeah. And Maria's like, not the first one I've seen, so I'll see you in a couple days.
When you were saying about the lady bits and all that, I see anything and everything, and nothing phases me anymore. Literally nothing phases me.
Yeah. So, well, this is going to be a fun show. So let's get into it. This is for really all of us, anybody listening, triathletes, runners, bikers. If you're training, you're out in the sun for hours and hours on end. Are you doing permanent damage if you're not taking care of yourself? And I think I think you are, and that's why we have Dr. Maria on here. We're going to be talking about skin, the long-term risk, how long us athletes are out on courses, not just in the race, but it's the cumulative effect of all the training. What are some of the mistakes that we make with sunscreen, not using the right kind, not using enough, not reapplying, that kind of stuff. You'd think that a lot of this is common sense stuff. Surprising how many people just really don't pay attention to it. How real is the skin cancer risk? Obviously, we've heard a lot about it, and we'll talk a little bit about that. And then once Maria learns a little bit about long course triathlon and just triathlon in general, then what are some good race day strategies for us when we're out on course? Because it's kind of hard to carry a tube of sunscreen in your pocket because you're on your bike because you don't have a pocket. And when you do have a pocket, you need to put fuel in there. So you'd rather get a little sunburn than not eat. So Maria, welcome. Thank you for spending time and doing this. Hopefully we can give a good plug to Fine Skin and get some business from all of us local athletes over your way.
Yeah, no problem. I'm excited.
All right. Should we hop into these questions?
Let's do it.
So the first question that we have is, what are the biggest skin risks that are unique to triathletes versus general athletes?
Sure. Yeah, I feel like, especially because with you guys, a lot of, obviously, it's outside, right? And there's different environments. Like, not only do you have sweating, which normal athletes have, you have the swimming component as well, too. And the clothing, so again, I don't know exactly how covered up you guys like to be, but I feel like a lot of general athletes for the most part, they're pretty covered up. You guys are pretty exposed. So I would say like the risk is a little bit higher. And, you know, also with all of your training, right? Because you guys train outside a lot. So there's a lot of increased and unique risks, I would say. You know, you guys got more friction from what you're wearing and like with the wetsuits, all of that as well too. So there's definitely some unique skin risk factors that you guys experience that normal athletes don't. They're also potentially wearing helmets or baseball caps. You know, you guys aren't necessarily wearing that, so you're not getting the extra head protection or ear or face protection. Yeah, you guys have some different risk factors than I would say your normal run-of-the-mill athletes have. And your skin is also exposed to different environments too, just obviously like with the swimming, depending on the water type that you guys are swimming in too, which is I think unique to that as well.
Yeah, and we are
Yeah, I
out
think
there for a long time.
Long time.
For a race, we're talking, you know, we typically in this group, we do half Ironman or Chad's done full Ironmans or he's convinced me to. So we're, you know, anywhere
she's doing
from
one.
anywhere from 6 to, I don't know, 12-ish hours in the sun all day. But also to Chad's point, that training that adds up. So talk to us a little bit about the skin cancer risk and kind of what's happening on that cellular level to your skin.
Yeah, absolutely. I mean, basically, you guys have heard this 1.5 million times with just hearing sunscreen and stuff. There's like UVA rays and there's UVB rays, and UVB is really what kind of breaks down the DNA in your skin cells. And so that can be dangerous in the sense that it's breaking it down. It can cause mutations, abnormal things going on inside of that cell. And your cells have to repair. And the more mutations that happen, so the more damage that happens, the higher there's a chance that when those cells are repairing themselves, they make a mistake. And then that can lead to something like a skin cancer. Or those cells die. So when we get burnt and we're nice and toasty, that is killing off those skin cells and they'll slough off. So that's a dead skin cell. So UVA or UVB is what's breaking that down. UVA kind of penetrates deeper. And that's really kind of, it's in essence like for creating free radicals. So if we're not familiar with that, those are just basically molecules that are really unstable and they cause oxidative stress and damage to your cells and DNA. But UVA is what you're going to hear with like it causes wrinkling, all of that, because it'll break down collagen and elastin. So really when you're outside, you're exposed to both. I think that immediate damage that you're going to see is from the UVB rays when people get sunburnt, that type of stuff. And then your skin cells try to defend themselves and they produce more melanin. And so that's where the tan comes from. So always ask, like, is tan skin damaged skin? It's starting to become damaged. That's your cell's response to try to protect itself, to create more of that melanin. So that's kind of what's happening on the cellular level in general. That UV exposure just kind of reduces your cell's immunity and effectiveness at protecting themselves. So that's exactly what your cells are defending themselves. But yeah, that's what's happening more on that cell level is the UV rays are damaging. And so we know that with that comes the potential for skin cancer. So yeah, to try to explain it in a way that everybody can understand it.
Yeah.
Sunburn means dead skin cells. Tan means your cells don't like what's going on and they're trying to defend themselves.
Yeah, and that was super helpful. And we do a lot of monitoring, like the weather, the wind, to see if we can go outside or what, like how to prepare for the outdoors. And there is, I know at least, you know, my Garmin watch, but a lot of people are watching the UV number now too. So is there like a number of like, it's okay to just run outside, not put much on as far as sunscreen, or is there a level where it's like, here's how much clothing you should wear. This is sunscreen level. This is long sleeve UV protection material level.
Yeah, I mean, obviously the higher the number, the more at risk and the more protection you should have. I mean, there is like a healthy level of sun exposure that we need without protection. But for most people, that kind of falls within like being outside unprotected anywhere from like a 10 to 30 minute range. And it just really depends on your skin type. So if you're a lighter skin type, like 10 minutes is cool, but if you're a darker skin type, you might need 30 minutes for your body to kind of get the benefit of the sun, which is like producing vitamin D. It helps with a lot of different regulations and stuff. So, but obviously I would say like, yeah, if the UV index is 10, I'd probably wait till that drops down a little bit more before you decide to take your like unprotected skin time outside. But yeah, there you go. Yeah, usually that falls between like 10 a.m. and 3 p.m. are like good time frames because you need the sun to do its thing, but not on a damaging level. But yeah, I mean, looking at that UV index, obviously lower numbers are better when you're reaching those like mid to upper numbers. You for sure want to have sun protection on, whether that's like a sun protective clothing or sunscreen. Yeah.
We went on that bike ride. I mean,
Mm-hmm.
what was that, like a week and a half ago or something? So it was 50, 60 degrees outside.
Mm-hmm.
I actually had already didn't even think because it's cool. I had long sleeves on, but I got the tops of my thighs. I already have a tan line from my shorts. So I was surprised that, alert, we're already in that warmer season or, the sun UV season.
Oh yeah, definitely. And it depends on your elevation too. So I mean, depending on where you guys are training and all of that, like higher elevation, that UV is going to hit you sooner than you think. And I think like, yeah, just to kind of go off of that, people are sometimes fooled by it being cloudy, but there's still UV rays that come through. Like I wear sunscreen every day, at least on my face and like exposed areas, but not gonna lie, that didn't happen until like I got into derm. Like I didn't do that before, but you really do get that exposure. Like you don't realize it even in cooler months as well. So just kind of getting into that habit if you're gonna be outside to throw some sunscreen on. Because like you said, you got your first tan lines probably, in 50-degree weather in April.
Yeah, right. Wild.
So, yes.
Talking
the
about
weather's been wild too, but
yeah.
than usual.
Following up on the sunscreen, does it matter what SPF you use? I've heard different stories, like anything over 30 is just numbers. It's not really helpful. What's the truth on that?
Sure. So I would say like bare minimum 30. Absolutely. Like that to me is like your everyday sunscreen, what you should be wearing. 50 was what I would recommend if you've got prolonged sun exposure. So obviously for you guys when you're training, anything above 50, it's kind of sketch. I would say it's not necessarily doing much more protection, but bare minimum 30 and ideally like for you guys 50 really does help with that. But yeah, like the 70s, 100s, I feel like there's really not much more protection that you're going to get from that.
Yeah. And the different sport outfits, like we really need to protect against those obnoxious tan lines.
Yeah. I can only imagine the array of designs you guys have.
Yeah.
Yeah. And that, like, to that point, like, I mean, I love sun protective clothing. I think that's like the best thing ever because you don't have to worry about reapplying. But like I said, like, I don't know what you guys like to wear, what you're comfortable wearing. Like, is a long sleeve, like UPF 50 too much,
Yes.
Okay.
But you will be, this is, speaking of sunscreen though, you'll be happy to know, Maria, that when, at least last summer at our Rockford triathlon, at the transition point when you're leaving to go onto your whatever segment you were on, they had a table with some supplies, water, things like that, and one of them was sunscreen. They were they had a whole pump bottle of sunscreen for all of us.
And they had people that would put it on for you.
Yeah. Oh, that's so awesome. I love it.
How waterproof is it really? Like, and how often should we be applying or reapplying?
Yeah, absolutely. I mean, so it's water resistant. Nothing is technically truly like waterproof. And then what kind of just makes it water resistant, it's going to stick to your skin better in essence. And there's certain ingredients that naturally repel that water. Whether it's like a synthetic film or if it's like sometimes they use silicone meshes or like natural waxes, mineral powders, those types of things. So I think obviously for you guys with the sweating and the swimming component, like obviously you should be wearing water resistant sunscreen. But the reapplication I think is the trick. And so realistically what the recommendation is every 80 minutes. And immediately after swimming or heavy sweating or like physical removals, like if you guys are sweating and you're toweling down, like realistically you should be then reapplying, right? So, I would say bare minimum, like every 2 hours. But if you're really heavy sweating, you just got out of the water, you just toweled off, like that should be a reapplication time, which
Oh,
I can
not good.
imagine is very difficult.
It should have been the whole time, just spraying it right on.
They should just have like
Because it was
various
like
ways.
105.
Yeah.
Yeah.
So,
A water mist and then the
Yeah,
sunscreen
right.
mist. Like just keep
Yeah,
going
just like
through it.
please close your eyes and don't breathe when you go through it. But yeah.
Yeah.
Okay, question. This is not sponsored. We did not prep this. What is your favorite go-to sunscreen then for like being active?
I like, it's called Think Sport. And I use like Think Baby on my babies. It's a mineral based sunscreen, so I'm kind of partial to mineral based, and there's nothing wrong with chemical sunscreens if they're the ones that you're going to use. But just for me personally, that's the one that I really like. But there's also a brand called Anthelios, Anthelios. It's made by La Roche Posay. They've got a really good one as well too. But yeah, so I personally use Think Sport if it's going to be like a sweaty swim day. The one I use in general, like if it's not a sweaty day, which won't even matter for you guys, it's called Pipette. Because you guys are always going to be sweatier in the water.
We like to lounge at the beach sometimes too.
There you go. I love Pipette. I actually discovered the brand when I was pregnant because they make like a belly butter for like preventing stretch marks.
Nice.
And it's like a really clean beauty brand. And sunscreen, I was like, heck yeah. They come in a stick, it comes in a spray, it comes in a waterproof and not waterproof.
And
but those
which
are
one
kind of,
was that?
that's Pipette.
Pipette.
Yeah, Pipettete. And then there's like a newer one out there, Sol, SOL RX. I have not personally used that one yet, but I mean, I always say the best sunscreen is going to be the one you're going to use. So
Is there much of a difference between the spray versus the creams or lotions?
yeah, there is. I'm not going to lie, I'm not a spray fan because you should be still rubbing that in. And I feel like people just are like done with it. Like they're not actually like spraying how they should be, where it's like a cream, you might be a little bit better actually like rubbing that in and covering those surface areas. I love sticks. I think they're awesome. And I think for you guys, they're awesome because you're not getting your hands all nasty. You're
Yeah.
not breathing in sunscreen. They can be small and compact. I mean, yes, you have to take the time to kind of do it, but I think that's great for sports in general. And for like you
Yeah.
guys, I would say that's probably what I would recommend. But I mean, in reality, like if you're using them correctly, they're all effective and they're all great. But yeah, that's just me personally. Like I'm not a big spray fan, and it is super convenient, obviously, like the back area and all that. And when you're on the go and on the run, I just feel like it just doesn't get applied the way that's supposed to be applied. And so then people get these like splotchy burns and are like, yeah, funky looking burns and tan lines from those. So,
Well,
and
these
some people
guys,
react to the aerosol too. So you got to be careful
Yeah.
with that.
Yeah.
Can you talk a little bit about the difference between the mineral based and the chemical based
Yeah.
sunscreens?
Yeah, so basically what happens is like with chemical-based sunscreen, the UV interacts with that and the chemicals break down those UV rays and it releases like a small amount of heat. And that's basically what it's doing, breaking down the UV ray via a chemical reaction, and it releases a small amount of heat. The mineral sunscreens are more of like a barrier in essence, but they also do break down that UV ray and release a small amount of heat too. So, and the ingredients are different, right? Like you'll hear all this stuff about whether things are hormone disruptors or reef safe. So if you guys are doing something that's like in an area that you have to use a reef safe sunscreen, typically you're looking at more of your mineral based sunscreens. I like mineral because I can see where I'm putting it, to be honest. Like I will see if I missed an area because usually there's a little bit of a white cast. Some of them are better at blending in, but yeah, so it's just basically the way that it helps to break down those UV rays is the main difference. And you got your physical blockers more so with the mineral base, and then the chemical base is that reaction that breaks those UV rays down. So, but like I said, I'm partial to mineral, but it doesn't mean that the chemicals are bad. Whatever you're going to use to protect your skin.
Well, when we're racing or our cycle and race gear are it's like a spandex material, and we actually have a kit that we're ordering for our group with our logos and everything on it, which is kind of cool. But
Yeah.
that kit is actually 50 SPF.
Awesome.
And it was funny because I showed April and Grace last year. I did a race in Chattanooga, and it was super hot. Sun was out all day, and the bike ride, I was on the bike for almost 6 hours, and middle of the day, so the sun's up, and
Mhm.
it was hot, it's sunny out, and I had sunscreen on my neck and my face and my legs, everything that wasn't covered.
Mhm.
I literally got sunburned through the shirt because I
Mhm.
wear
Yep.
a heart rate monitor, and there
Mhm.
was the white strap from, you remember that picture I showed you guys?
Yeah.
I looked like a lobster, and I didn't even think
Yeah.
this sunblock
Yeah.
underneath the gear.
Yep. Yeah. Definitely. I mean, it's one of those things too, because like, right, it just depends on the material. So like, obviously, yeah, you're wearing a shirt, like you're thinking like this is physically blocking the sun, but if it's super stretched, like especially over your shoulder areas, like that material is getting stretched thinner in those areas, and so it's not really blocking the sun. Those fibers aren't blocking the sun, in the way
Mm-hmm.
that they should. And if they're old or, like kind of more worn out, those types of things I feel like we don't necessarily think about. But yeah, so definitely I would say you need to still be putting on a layer of sunscreen underneath that for sure. But then
Yeah,
the reapplication underneath that is not the easiest, I would expect.
yeah. I've got a new job for my Sherpa. Yeah,
Yeah,
Linda,
but
she's not
can't
going to be
wait.
thrilled at all.
All right. So,
Maybe Maria, you can tell her next time you see
Yeah,
her that
yeah,
she has to reapply on my back.
it's a medical
Every
need.
60 minutes.
Oh,
Yep.
yeah.
Can I
Yeah.
have a doctor's note for that?
Right, exactly, right? Absolutely.
So we all know the tips and tricks for sunscreen, and that was
Yeah.
super helpful. I do think they're great
Yeah.
reminders because even, I just went out and forgot to put sunscreen on a cool day.
Yeah.
And I love the tips on the products.
Mm-hmm.
But I think one thing that I think we talk about it often, but
Mm-hmm.
we don't get a lot of help with swim skin issues.
Mm-hmm.
I didn't grow up a swimmer, so I'm not as familiar
Sure.
with like those kind of swim tips
Yeah.
and tricks, but it's, I'm sure you see a lot of swimmers or people who have pools in the summertime. It's those
Mm-hmm.
chemicals that are on your skin,
Yeah.
and in your hair. And so what are your tips for our swimmers here?
Yeah, I mean, and it kind of like, again, it depends on what water you're swimming in. So, like, if it's a chlorinated pool, like, that's going to be a different reaction than if you're swimming in natural water versus like salt water. But I mean, we know chlorine strips the natural oils of your skin. Like, I don't think anybody comes out of a chlorine pool feeling, hydrated or their skin's feeling that great, especially if it's like a public pool and it's being over chlorinated versus
And
just like your
Pete.
own. Yeah, everything. I say this all the time because I know all the time. I'm like, I do not trust what happens in public pools. So like, if you have any open sore, like just don't, because I know it's chlorinated, but like just don't, unless it's your own personal.
Yeah.
So yeah, the chlorine, like it strips the natural oils. It causes dryness. It can cause irritation. I see some patients that literally get like eczema-esque reactions or contact dermatitis to chlorine. And, there's some kiddos I have to write out of their session at school because their skin just does not react well to it. But obviously if you're competing in that, one thing you can kind of do is like shower, get your skin wet before, because then you're going to absorb a little less of that chlorine, so your body's not going in and dry. It's already wet, and it helps to kind of a little bit, like you're not sucking in, your dry skin isn't sucking in all that chlorinated water right away. It's already like kind of being quenched by like fresh water out of shower, or just wearing kind of anything that's like a barrier cream. If you have sensitive skin, for sure. I mean, those are your like Vaselines, Aquaphors, even like your mineral based sunscreens, those types of things. Salt water, is different in the sense that it kind of just dehydrates the skin. So same thing, it's going to dry out the skin, but there's not really that irritant factor like a chlorine pool would be having on the skin typically. Like I don't really have people saying like I have contact dermatitis from salt water. It's chlorine, and then fresh water is obviously going to be your best bet minus all the buggies, which
And the
you don't
fish.
really need to. Yeah, that they're fine. They're fine. They'll just nip. But yeah, yeah, I would say chlorine's probably like the most abrasive thing, and
Yeah.
it's just you have to ideally shower that off, which you guys can't. You're moving on to the next thing, but like trying to get that chlorinated water off your skin as soon as possible, just to kind of reduce the irritation from it. So, but yeah, just lotions, like anything that kind of helps to repel water can kind of reduce that water issue.
That's interesting. I've never heard like getting wet first.
Pre-wash.
Sorry. Yeah.
Yeah. Yeah.
Maybe that would be
I-
super helpful for you, Grace, not to break a HIPAA violation, but
Yeah, no, I was going to say I have horrible reactions to chlorine.
Yeah.
My hands peel. Well, I have skin conditions baseline, but the chlorine exacerbates them. So badly.
Yeah.
To
You
the
would
point
definitely be
where,
so,
like, I have skin chunks peeling off of my feet and my hands and open sores.
yeah.
My derm has said Vaseline, Aquaphor, all that, but by the time I leave my home, all lubed up, and then I'm greasy everywhere. And
Yes.
I get to swim, and then I go to the bathroom and I wash my hands. It's
Yeah.
not practical. And now I am making sure I get out of the pool in time to rinse at least
Right.
partially. But now
Yeah.
we just learned that we can't.
Yeah.
Yeah.
Really?
But so
Yeah.
I was recently told zinc oxide, which
Yep.
is,
And yep. That's
well,
what's in mineral based.
yeah.
Yeah.
So my
This is in
mom's
mineral
in an
based sunscreen.
assisted living facility,
Yes.
and she uses it for like her
Yeah.
pull-ups. So I stole a container of hers, and I'm like, but it's so thick. Do you think that would be better than Vaseline?
I mean, yeah, I mean, zinc oxide, again, like you think baby creams like Desitin, those types
Yeah.
of stuff, like its main function, and that's what's in those mineral-based sunscreens, is to be a wetness barrier, so skin protectant barrier, so that doesn't irritate the skin. So absolutely, because I mean, I know 100% what you mean with like the Vaselines and the Aquaphor. You are just like a slip and slide. And I think zinc is easier, kind of to apply. You're not as yucky. The
Yeah.
trick is getting it off after.
Yeah.
You want to use an
Right.
oil-based cleanser
Yeah.
because
And
that's
then
what's going to
go in
break
my
it
bathing
down.
suit. And I don't
Mhm.
want to be the only one in the locker room
With
pulling
butt
up my
paste.
jar of Vaseline and like nobody's like, yeah. So this is a
Yeah.
helpful conversation. I don't feel all
Yeah.
alone. There are other people.
There are a lot of other people out there that get a reaction from
Yeah.
that for sure. And like if you guys can't shower, I mean, I don't know what your protocol is, but like even having like, because again, I have young kids, so of course I've got like baby wipes on the brain, right? But
Oh,
like water wipes are one of my favorite brands. It's literally like mainly just water. Like having some of those in your pack and just kind of like wiping down really quick, just to again try to get some of that irritant
yeah.
off the skin.
I didn't even know that was a thing.
They got to go packs of them in Target in the dollar section or the travel section. So, or you can buy obviously the normal, but just something like that. And even like with sweating, like I'll tell some of my athletes, just water wipe down if you can't take a shower right away. It's an
I've
easy.
got a good suggestion.
Yes.
Before swims from now on, I'll bring water bottles and I'll dump it over your guys' heads before you guys jump
There you
into
go.
the pool.
Yeah. There you go. Yes. Yes. But, yeah.
All right.
So what's up next? So I know on the questions, this was kind of my question.
Mm-hmm.
Are there risks of bacteria in water? We normally swim for our races in some form of open water,
Mm-hmm.
whether it's a river or a lake.
Mm-hmm.
I don't see oceans in our near future, but certainly rivers. And the last river swim I did, I was kind of nervous because they're not the cleanest waterways that we're swimming in. So the Rock River in Rockford is kind of gross.
Yeah.
The Tennessee River in Chattanooga, I mean, you can't see your hands in front of your face. The water's murky, and so I called my primary care doc, and I'm like, hey, I'm swimming in a river. Can I do some type of a prophylactic antibiotic treatment beforehand, because I was worried about the bacterial risk. And he kind of looked at me like, dude, don't worry about it. But he gave me the prescription anyway, and I did it. But
Yeah.
what are your thoughts on the risks of bacteria?
Yeah. I mean, I think the main risk is like if you have an open sore, because that's obvious. Like your skin is there for a reason. Like, would I be super concerned about bacteria if you didn't have a break in your skin? No, I mean, like that's what it's there for, right? It's your barrier. But if you have breaks in that barrier, then, you're opening a channel potentially for bacteria to get in. And yeah, we know that rivers and lakes and there's bacteria in it, but have I had patients go into them with open sores and been perfectly fine? Yeah, like you're not doomed if you go in, but you're at a higher risk of potentially getting a different type of infection. Yeah, and again, like I would say like a barrier cream or like a waterproof bandage if you have to go in the water with an open sore or something along those lines. And like what did he prescribe you? Was it like chlorhexidine or Hibiclens or something? Or
No, gosh.
I was just
Hang on.
curious.
You guys keep talking and I will tell you. It's in my, I got to
Look at
go
his
to my
drug
Walgreens app.
So what about, after swimming with the open sores, right? Then you're super dry, but do you really want to put lotion over that where it's so dry and peeling? Because I feel like it's dry and peeling, and then you're going to put lotion over it. Of course, it stings, but what do you do about that?
Yeah. So, I mean, again, anything, it's going to sting no matter what you put on it if it's open.
Gasoline doesn't hurt that bad.
Yeah. Yeah. As I say, Vaseline or like I love Aquaphor Healing Ointment and Vaseline. Like I literally recommend that for a lot of stuff. But yeah, I mean, again, like you would want to, if you feel like it was infected, you want to cleanse it. And like one of the things that I just talked about, the Hibiclens, you can get that over the counter and you don't need to wash that off necessarily. Like you can just kind of like pat that on, clean it. And then I would throw, Vaseline or Aquaphor over, because when you have an open sore, basically your body has lost the ability to kind of like hold moisture in that area. And so it's going to lead to further damage and further inflammation. So what you're doing by putting that occlusive, so again, something like a thick ointment, it's helping to basically make up for the skin that's lost in that area. So that tissue has time to heal and can heal properly. So you do want to cover it. Like a normal lotion is not going to do much if it's an open sore.
But Maria, I really love my glitter lotion.
You can glitter lotion all you want.
Okay.
Not open sore.
Just if you have an open sore, don't put your
okay. I got really nervous. I'm like a 13-year-old girl for some reason with my glitter.
You want to glisten in the water. I guess.
Yes. Yeah. I bring the vibes. Like, you know.
The mermaid vibes. I love it. Absolutely.
So my medicine was cephalexin.
Oh, he gave you Keflex? Like a pill?
Yeah. It was
Don't say his name. He might get in trouble.
No. Chad told me that, so I asked my primary care. I'm like, are you going to give me an antibiotic? She's like, no. You'll be fine.
You'll be fine.
Guys, I have to do, like, they're called CMEs on, like, improperly prescribing antibiotics. It's overprescribed for reasons like that, but it's okay. I'm not docking anybody's medical decision making. So.
They only tetanus shot. That's all I got.
Well, I can be pretty persuasive. I'm just saying.
Yeah, it's all good. You know the right things to say to him. Be like, okay, I'll give you this. But yeah, I mean, I would say like there's not much to do because again, not everybody's going to get an infection. You know, the best thing you can do is cover it and cleanse it as soon as you can. And obviously, if you feel like there's signs of infection later on, then get in to be seen. But yeah.
Well, you know, the bandages for the bandages that tattoo artists use, where they cover the whole tattoo, they leave that on there. Those things are absolutely amazing. They stay on for like 3, 4, 5 days.
Oh yeah, like so a Tagaderm or something.
Yeah. So those would actually hold up really well. I didn't think of that. If you have an open sore, you can kind of cover it with one of those.
Absolutely.
Yeah.
Yeah. You just want to protect if there's a break because your skin does an amazing job of being a barrier. That's why we don't get a ton of infections, right? But when you have that break, you need to help it a little bit. So yeah.
One you mentioned earlier, jumping back like 2 questions ago, you mentioned using Desitin and the zinc oxide. Maria, a few years ago, I was getting saddle sores a lot, and I was trying different chamois creams out for when I ride, and I started using the Desitin and then the chamois cream, and I haven't had a problem since. And that it's really thick and it is hard to get off, but it certainly stuff does the trick. So when I don't have like a flare up or a saddle sore, I don't normally use it, but as soon as I start to get them, I
Absolutely. Yeah. And like, again, like just an oil-based cleanser, like every brand makes them, like Eucerin has one of my favorites, or La Roche-Posay. That oil breaks down the zinc oxide. And so that's what you're going to want to try to use to cleanse it off. Because otherwise you're going to be Desitin-y for days.
Yes.
Always ready for that bike ride.
My husband's like, I feel like I'm scraping off a layer of skin, like trying to get it off, but
Well, in certain areas, it'll ruin your underwear for
forever.
For sure.
All right. Should we ask about how to wash ourselves? I feel like we're going to have the best hashtags for this one. Lube, bush, unprotected skin time.
Yep.
That one is definitely going to be a hashtag.
The first one, number one.
No
Love it.
unprotected skin.
So what are your recommendations about like such a general question about like washing, but like to prevent acne, to prevent,
Yeah.
any kind of irritation on your skin?
Absolutely. I mean, I really like, they're called soapless cleansers. So like if you're not super dirty, you can use something called like a soapless cleanser. And those are brands like Cetaphil, CeraVe, Vanicream. Eucerin has them, but they don't have like the stripping of your oils like a Ivory Soap Bar or like Irish Springs. Like those types of things are very drying, and yes, they smell great, but they really do like strip your skin, and you need to kind of then moisturize a lot more to kind of like help repair that. So just kind of like any gentle, I love Dove Sensitive as well. Like that's probably like my biggest go-to because it doesn't have, again, scent profile, all that. So like I'm really against scents as well. Not saying I don't use them because I like to smell nice too, but it can like disrupt that barrier for some people, especially if you have sensitive skin. Like Grace, you said you have sensitive skin, like you should
I can't
100%
use any
stay
scent.
away. Yep. All like on fragrance, so, but I like those for cleansing, or like I said, like one of those oil-based cleansers if you have that like zinc or mineral sunscreen on. And then the biggest thing after is like water temperature. I think we don't pay enough attention to. Like I'm guilty of scalding hot showers in the winter, absolutely, but that really dries your skin out too. So more like lukewarm, and then just trying to keep the showers or baths to a shorter time frame, because the longer you're in that water, the drier you can get. So again, with like condition, I know, right? It should be like 10 minutes or less realistically in a water, but then like moisturizing immediately after. And I am not good at it. Like my face 100%, the rest of my body, like I feel like I'm so ashy all the time until I like finally notice. I'm like, oh dang, I'm wearing shorts today. I look way whiter than I am already. So
Yeah.
but yeah, just kind of like getting that moisturizer on right away. But yeah, I really like, again, like not to promote brands, but I really like, Vanicream is one of my go-to cleansers. And like I said, Dove Sensitive, CeraVe, Cetaphil. Acne is a little bit trickier because it just kind of depends on your skin type in general. So if you are an oilier person, sometimes I'll recommend using like a salicylic acid cleanser because that helps to break down the oil, but it can be drying. So again, you have to be careful with that. But for the most part, I feel like people's bodies, like if you get the chest knee or the back knee, using something with salicylic acid and helps to kind of reduce acne
Or the
or
butt,
benzoyl peroxides
or the butt acne. I mean, those
acne.
swimsuits are real small.
Yes,
Yeah.
absolutely.
Whoa,
Same thing.
whoa.
And again, like
It is real.
your butt skin is tougher; it can handle it. Yeah, definitely.
Yeah, I think that was
Benzoyl
one of the best
peroxide.
tips I got was for, I mean, not to throw myself under the bus and tell an embarrassing
Yes.
story, but the salicylic acid wash on your little booty for those little
Yep.
swimsuits. But can I ask you a question really quickly though?
Yeah.
Just so you talked about like the soapless ones and it's stripping. Are we supposed to do a double wash? Are we not doing a double wash? Should we double wash our hair for the chlorine
Yeah.
too? Or are we just doing
It
single
depends.
washes?
Yeah, I mean, it depends on, I don't know. Like it's so individualized, So again, I would say double cleanse if you feel like you're super dirty, or like you're still, you washed your hair and it's still, your scalp still feels itchy, something along those lines. Could you? But like, does it really do much? I don't know. I really don't feel like it does, unless you still feel like soiled, after you cleanse once. Like if you still feel like, I still feel like I'm greasy or have sunscreen or whatever on, like, yeah, go ahead and double cleanse. But yeah, I mean, it's just kind of personal. Like, let's be honest, like really, really, like when you shower on a normal basis, if you don't have yuck all over you, like armpits and private areas in your butt, that's all you need to wash, because everything else, just kind of like soapy water runoff, is more than sufficient to kind of cleanse it. But like if you have sunscreens and stuff, then yeah, I mean, you're going to wash the rest of your skin, or chlorine, you're going to wash the rest of your skin too.
Excessive sweat, all of the
Excessive
above.
sweat, yes, which you guys have for sure. And those hot temperatures, yeah. Yeah, so I mean, double cleansing I think is like a personal preference. It just depends on like how you feel after your first cleanse, I guess.
Yeah. And I think those soapless cleansers always mess with my head because I'm like, if it's not bubbling, it's not cleaning.
Right. And I had to get used to that as well too, but like it is.
Yeah.
It's still cleansing enough, And then obviously like it's different. Like if you have something nasty on you, then you might want to use like an antibacterial soap or something like that. But because those are the most stripping of your skin oils and all of that. So there's a special time and place for that. So yeah, but yeah. But I was gonna say make note on like benzoyl peroxide too, because that was like all in the news. I don't know if you guys probably don't follow skin stuff, but there was a big study out on benzoyl peroxide, and if like it reaches a certain temperature, like it breaks down into something that can be carcinogenic, especially like your liquid based ones. So a lot of brands kind of pulled their product off the shelves and blah blah blah. It's still a safe product, but if you want to be like uber safe, like bar benzoyl peroxide, so Panoxyl is a brand that makes like a bar soap with benzoyl peroxide. It's more stable than a liquid version at higher temperatures. So just a side note on that.
Interesting.
Yeah, but sal acid is great. I love sal acid cleansers. I use one like a couple times a week just on my face for exfoliation. So yeah.
All right. What topic do we want to hit now? I feel like we could ask you questions for days.
Forever.
Yeah.
Forever.
Like I said, I'm off kid duty right now, so it's all good.
Let's see, where did so we kind of covered a bunch of the questions throughout the cheat sheet. Do you want to go to the quick kind of rapid fire? We actually hit some of the rapid fire ideas. We do this rapid fire when we've had guests where we ask the question and you get the answer. But I've kind of got one that's going to be I only want a quick answer, yes or no.
Okay.
No commentary, especially from the other two. So this has to do with toenail fungus. I've heard on good authority that only girls get toenail fungus, and that's the reason they wear toenail polish.
What?
False. False.
Chad must have toenail fungus right now. That's what I was asking.
That's
Actually, go ahead, Chad.
That's a HIPAA violation.
You guys can talk about yourselves. I just can't disclose what Chad has.
So I went to a podiatrist years ago when I had my first case of black toenails after running. This was years ago, probably 10 years ago. I don't know. And he was like, he said fungus. I didn't know what the hell. And he removed 2 or 3 of my toenails. Then I went to my dermatologist and she's like, what the hell did you let this person do to you? So, Maria, should we be allowing podiatrists to remove our toenails for
black toenails
without having a dermatologist look at them?
I don't know. So can I tell you how I learned how to like remove a toenail and how like I absolutely will not. So any of your listeners don't come at me with like ingrown nails because I will not do it. It gives me the heebie-jeebies. It was a toe on a stick, like literally like a plastic foam toe
Not
on
like a
a
dead
stick,
person's
popsicle
toe.
or sucker.
That's what I thought.
And they like teach you how to do, it's called a nerve block. So how to like basically numb the toe so you feel nothing, and then like how to slice it and like literally like yank out the nail. Like it gives me the heebie-jeebies just thinking about it. So if you came to see me with your black toenail, like I absolutely would not be removing it.
Is there a way to test? Because mine were not fungal. They were just bruised.
Yeah, no, you could do a nail clipping. Like you could literally just cut part of your toenail and send it off. You don't need to take the entire toenail off.
Okay, so all you listeners, don't let any wacky doctors just start taking your toenails because they will never grow back normal. And
I mean, there's a time and a place for that. Like again,
right.
Yeah, like in the mob, like.
I'm not discrediting like anybody's medical decision making, but no, like I've done nail samples. I mean, you have to have a long enough nail. Like I've had people come to me and I'm like, there's not enough nail for me to like cut, you know? So, but no, it takes some time though. Like it takes like up to a month for that nail sample to come back, whether there's a fungal growth or not.
That's excessive. Right?
It is.
Yeah.
We get weekly reports, like if stuff's grown out, but they have to grow it out, right? And it takes a while for that fungus to grow out on those cute little petri dishes. So it takes us some time. So like usually what I'll do is if I'm suspecting it, like I'll treat you for what I'm suspecting, and then we'll kind of like do that as a conclusive. Or sometimes, you know, I'll have patients that like we thought it was this, we start treating it, it's not. And then we'll do like a culture and just see. But toenail fungus really stinks to treat because it takes forever. Your toes take forever. Your nails take forever to grow out. Like we're talking about months to years for some people. So like
if you for you girls,
it feels like if it looks like you're starting to get a yucky nail, get in to start getting it treated. Yeah.
I only have yucky nails now because they were removed.
Like they were just traumatized. Maybe there was some damage to the nail plate in the back, and that's why they're kind of growing out funky.
I never went back.
I mean, again, that's probably why he's in podiatry. He probably is like super excited to rip off people's toenails. I don't.
It sounds like it. Yeah.
Never went
Yeah.
to the podiatrist again.
Yeah, that's interesting. Again, like you can take a nail clipping and not have to remove the whole toenail. I mean, there's times where that's appropriate, like if there's trauma or, you know, stuff like that. But yeah.
All right,
So,
let's
no,
do.
Chad, not only females get toenail fungus, and that's why they wear.
Thank you. Thank you.
I thought it really hard to come up with that one.
I'm sure you.
Oh my gosh. Okay, I'm gonna do the rapid fire round questions that we haven't already asked because I do like the ones that we have on there. Are you ready?
Yep.
You have to give us quick answer, first answer off the top of your head, not a lot of commentary. Just give us the answer.
Okay, I'll try.
Ready? What is the most underrated skin protection habit?
Not applying soon enough.
Okay.
Sunscreen. Not applying sunscreen soon enough.
What is the biggest mistake? This doesn't have to be for sun, but what is the biggest mistake you see athletes make?
That's hard. Not for sun? I don't know. I'm not good at this, guys.
It could be sun.
I was just to say, yeah, not wearing sunscreen.
Not wearing sunscreen. Okay. Yeah. What is one thing every triathlete listening should start doing today?
Get your skin checked annually at least.
I love that. Very good.
Because we've all had, and I know you said no explanation, but a lot of the sun damage happens before we're 18. Our skin's more susceptible to sun damage. And let's be honest, we were all outside playing all day, right? We were still that generation, not on a computer or tablet all day. So, like, I don't know about you guys, but like, my parents would put sunscreen on me when we went swimming, but like on the day-to-day basis, not so much. And I definitely was not coming inside and reapplying sunscreen unless I felt like I was burning.
Yeah.
So a lot of that damage has already happened to you prior to you're an adult, you know? And so then obviously when you are an adult, and if you're doing something like training sun all the time, that damage can still happen. So yeah, absolutely getting your skin checked at least once a year, especially if there's family history too. Yeah.
I agree.
That wasn't a rapid answer, sorry.
That was it. That was a good piece of information though
good.
to end on. Wise words.
Yes.
Yeah, I mean, I think my recommendation, I'm kind of overprotective of myself because of the family history. But when if I see a spot that I didn't see or didn't notice before, I'll make an appointment. I'll go see Maria, and she'll be like, "Yep, nope, don't worry about it." Or sometimes we'll freeze it off, and it's a little discomfort to freeze stuff off, but I'd rather freeze it.
Yeah, catch it early.
See in 6 months. As much as I like seeing Dr. Maria, every 6 months is good enough.
I know. Yeah, I mean, and just like also just being aware of like signs of skin cancer. Like I think at some point we've all learned, the ABCDEs of melanoma, but there's other skin cancers that exist, and those are the more common ones. And those are squamous cell and basal cell carcinomas, and just kind of familiarizing with something like what that would start off like a basal cell is sun exposed areas, can look like a pimple that just doesn't resolve, or like a little papule, pearly or pink, just never goes away. And then squamous cell usually starts as like a little pinkish dry patch of skin that some people are like, oh, I just have dry skin, I put moisturizer on it, it doesn't go away. Because it's not just dry skin, it's skin damage. And that can then lead into skin cancers. Just kind of being aware of like anything that's not going away or not responding or something that keeps coming back. Those are usually signs that it's not just a blemish or it's not just a little dry patch of skin. It might be sun damage, and to just get that checked out. Like I always tell my patients, like absolutely come in. Like I'd rather you come in and it be nothing than you're waiting thinking, oh, it's nothing. And then it is something and it has progressed, and then obviously melanomas, like I said, I feel like most people are familiar with the warning signs of that, but anything that's changing or becoming symptomatic or a new spot that's like rapidly growing, those are all indicators to get it checked out. I have a ton of patients that come in for benign spots. Like when you get older, a lot of people grow these things that are called seborrheic keratoses, and they're really scary looking and they're completely normal. But like, again, like I'd rather them come in and me tell them like, don't worry about it, it's just because you're getting old, versus it being something scary. So just familiarizing with skin stuff doesn't go away, doesn't heal. That's not good.
Yeah.
What it boils down to.
And Fine Skin, you guys are always real accommodating.
Yeah.
If you call, if I've had things where I'm like, all right, this really looks bad, and I start freaking out, and I'll call and they're like, well, we can get you in next Thursday, and I'm like, how about now? And they're like,
Okay.
they figure it out, and they'll go
We,
talk to Maria, and she'll
yeah,
be like, all right, yeah, he's a freak.
yeah.
Let's get him in.
Especially
Liar.
rashes too. Like rashes, we try to get you guys in right away because they're usually uncomfortable, and we want to get those treated as soon as possible too. But yeah, we try, Yeah, and it usually never bothers me, like unless you're at the end of my day and I need to go pick up my kids, and then I'm looking at my staff like, really, you just added someone right now?
And Chad waited until 3:30 to call the office about his toe fungus.
Yeah, seriously, Chad, come on. Yeah. No, we try to be accommodating, but yeah, it's just be knowledgeable about your skin and protect it. I mean, it's your biggest organ on your body, and it's your first line of defense against a lot of yucky stuff. And it also absorbs a lot, so just being conscious of what you're putting on it, and yeah, just
Well, and be aware of the parts that you can't see too, and have your
absolutely,
spouses look at
yeah,
stuff, even though it's
Yes.
embarrassing sometimes. Just say,
yeah,
I have no shame, and Linda's.
I don't either.
yeah. You guys see everybody's parts on your swimming excursions. So
I'm telling
good.
you.
And triathlon. I mean, it's all out
Yes.
there.
Yes.
Yep.
Yeah. Yeah,
We poop
absolutely.
in
And
the
then,
woods.
yeah,
Grace pooped
taking
in the woods for the
photos.
first time on a run.
I was gonna say ticks. You guys better be tick protecting this year. They were bad last year.
They were
I've already
really
had
bad
one
last
person come in
year.
with a tick bite this year.
So what
What
should
do you
we?
use for tick? What is
I've heard DEET's not good for you.
no, right? But it
Yeah,
works.
I mean, it works. So there's other things like I like using, it's called picaridin. So I've used that as a spray. I use that on my kiddos as well.
What's it
On
called?
your picaridin, picaridin. That's another ingredient that acts like DEET. I mean, I've used DEET sprays. It is what it is. And also for your clothing, though, you can get permethrin. Permethrin spray is really great. It does not go on your skin, but for like clothing or like around your socks or shoes, that's really great at repelling ticks. Again, obviously, if you guys can wear a sleeve or like wear a hat, that's awesome. But then just doing those tick checks after you guys are training or you do something. And again, you got to look in all the nooks and crannies because they like warm spaces.
Grace, we're going to have to do our poops together now in
Yeah.
couples, I guess.
Yeah. Because if you catch it and it's only been adhered for a little bit of time, and like pay attention to what the tick looks like too, because there's ticks that carry things like Lyme disease and others that don't. I had one on my head that was awful, guys. I thought it was a
Ugh.
scab. And my coworker was like, "What's on your head?" I'm like, "I don't know." Got home, was in the shower, and like was like, "God, this is a big scab," and I just ripped it because.
Oh.
And I looked at it and I screamed and I threw it, and I'm like, "Oh my God, this is a beep tick." I freaked out. No idea where it plopped down on me from because I live in a wooded area, but like I hadn't been outside recently. I'm like, did it drop on my head like walking into work? But again, just really checking, do those tick checks like that day, because if it's not adhered for a long time, the likelihood of it transmitting anything is less versus if the longer it's on. And there's prophylactic meds for that as well too, if you do get a tick bite. And it's concerning. Yeah, just I wanted to make note of that because I was like, I think you guys run through woods too.
Yeah.
But I've heard rumors that they're supposed to be bad again this year.
I got a tick last year running like late summer. It was really hot. I was running through a wooded area, and I got home and I took a shower and I was sitting on the couch and I had something itching my neck, and I grabbed it like you did, and I was like, "Are you kidding me?"
Mm-hmm.
And there was blood everywhere, and we actually got a picture of it. So Linda did like the Google image thing, and it turned out it was, but it must have dropped off of a tree or something, and it just.
Now my head's itchy. Everything itches.
I know, right?
Thanks a lot.
They crawl up. I mean, I had another one on me last year. It wasn't adhered. My mom had one on her. It's like, it is what it is. It's the area we live in too. So just do those tick checks. Because it's on the rise. For whatever reason, I was hoping it just had to do with like the cicadas, maybe like last year, and maybe like they ate stuff or the ticks had more to eat, so they were thriving. This year, we obviously didn't have that, so I don't know. I don't know what's going on, but just check yourselves, your nooks and your crannies for sure.
Your Sherpa has another tab.
Yeah.
Yeah, I got a whole list here for her. I'm going to go down and say, all right, here's what we talked. She's good. So awesome. Well, that was a really we didn't have that on our list, so I'm glad you brought that up because
Yeah.
that's something really relevant for us.
Absolutely. Yeah,
This,
absolutely.
Maria, thank you so much for doing this.
Yeah.
No,
Thank
This
this was
has
you.
been
fun.
awesome.
Thank
This is
you.
my first podcast. It was
Yeah.
exciting.
Thank
All
you.
right, well,
Good. Thank you.
Yeah.
Hopefully you'll get some
yeah,
new visitors. I'll come and see you.
Yeah. Yes.
this was very generous. If, as long as you guys are okay with it, I'll put the Fine Skin and the number and
Yeah.
everything in the show
Yeah.
notes, and
Yeah.
we'll pass it
Absolutely.
along for everybody. But anybody listening, nobody other than Maria. No other docs, only Maria.
Just
Yeah,
Maria.
right. Only me. Only me. So. No, my coworkers are great. I've been there for 9 years. They're awesome. We all bounce off each other too. If we don't know what's going on with you, we'll talk about you and try to figure it out. So
Yeah. So someone will remove your toenails, just not Maria.
Yeah.
Yeah.
God, I can't. Like anytime I see that, like my MA comes out and it was like ingrown nail. I'm like, ugh, no, like
Toe pops.
no, the toenail. I could like probably find that picture and send it to Chad. It's awful.
Ugh.
It was horrible.
Yes, please do. We'll use it. We'll use it on our social to promote the
Yeah.
episode. You have to tune in to figure out what the toe popsicle's all about.
Yeah. There's another hashtag toe popsicle.
Awesome. Yes, thank you so much, Maria. The reminders were
absolutely.
awesome. The tips were awesome.
Everything.
We appreciate you.
No
Yeah.
problem. Thanks.
Thank you
Yeah,
so much.
absolutely. Until the end.
No, this is thank you again. We'll see you soon, and
Yes.
hopefully we get you some new business.
Yes.
Yeah, that would be amazing. Thank you guys. I appreciate it.
Yep. Thank you.
All right. Until next time, triathletes, keep at it. Summer's here. Go get your skin checked. We care about
Wear
you,
your
so
sunscreen.
we want you to go see a doctor.
Yeah.
Yeah.
All right. Happy racing. We'll see you guys next time.
Bye, everybody.
Bye.
Bye. So that's a wrap on today's episode of Manhattan Tri Club Leading from the Front. If you made it this far, amazing. You're officially one of us now, slightly unhinged, mildly obsessed, and probably thinking about your next workout. If you liked our episode, do us a favor, follow, subscribe, download, all the things. Send this to your training buddy who needs to hear this, or the one who definitely did everything we just said not to, kind of like Chad. You can find us on Spotify, Apple, and YouTube. And don't forget to follow along on Instagram and Facebook. All the things are at Manhattan Tri Club. You can find us there for workouts, chaos, and whatever we're getting ourselves into next. And hey, if you see us at a race, a group run, or just out on the roads, definitely come by and say hi. We're the ones having the most fun and probably talking about triathlon a little bit too much. So until next time, keep showing up, keep pushing forward, and as always, lead from the front.